Hello everyone, welcome back. In today's video, we'll explore one of the most important topics in pharmacology, that is anti-inflammatory drugs. Today we'll cover what is inflammation and how does it occur? What are anti-inflammatory drugs? How these drugs reduce inflammation, that is their mechanism of action, and some key examples you need to remember. So, let's get started. First of all, what is inflammation and how does it occur? When our body is injured or exposed to infection, the immune system activates a defense response called inflammation. It begins right at the level of cell membrane. When cells are damaged, an enzyme called phospholipase A₂ gets activated. This enzyme phospholipase A₂ acts on the membrane phospholipids and releases arachidonic acid. This arachidonic acid is the starting material for inflammatory process. From here, arachidonic acid can go down two major pathways. First is cyclooxygenase, that is COX pathway, and second is lipooxygenase, that is LOX pathway. In cyclooxygenase pathway, COX converts arachidonic acid into prostaglandins and thromboxanes, which are responsible for pain, fever, and vasodilation. While in lipooxygenase pathway, arachidonic acid is converted into leukotrienes. Leukotrienes are powerful inflammatory mediators that promote bronchoconstriction, increase mucus secretion, attract inflammatory cells, and increase vascular permeability. They play a major role in asthma, allergic reactions, and inflammation. Due to these COX and LOX mediators, classic signs of inflammation like redness, heat, swelling, pain, allergic reactions, and loss of function are seen. So, this is how inflammation occurs. Now, this is exactly where anti-inflammatory drugs step in. Anti-inflammatory drugs are medications that reduce inflammation, ease pain, and lower fevers. Anti-inflammatory drugs are mainly classified into two major groups. First, non-steroidal anti-inflammatory drugs, that is NSAIDs, and second, corticosteroids. Let's first understand the mechanism of NSAIDs, that is non-steroidal anti-inflammatory drugs. NSAIDs reduce inflammation by inhibiting the cyclooxygenase enzyme. Normally, COX converts arachidonic acid into prostaglandins and thromboxanes. These are the key mediators responsible for inflammation, pain, and fever. There are two main types of COX enzymes, COX1 and COX2. COX1 is present in most tissues. It protects the stomach lining and maintains kidney function, while COX2 is induced during inflammation. It produces inflammatory prostaglandins. NSAIDs blocks these COX enzymes. By blocking COX, NSAIDs reduce prostaglandin synthesis. As a result, blood vessels constrict, so redness and heat is reduced. Fluid leakage decreases, resulting in less swelling. Pain receptor sensitivity drops, causing pain relief. And temperature regulation in the hypothalamus is restored, so reduction in fever is seen. In short, NSAIDs cut off prostaglandin production, thereby reducing pain, fever, and inflammation. Now, there are two types of NSAIDs, non-selective COX inhibitors and second, selective COX2 inhibitors. Non-selective COX inhibitors are NSAIDs that block both COX1 and COX2 enzymes. Blocking COX2 enzymes reduces pain, inflammation, and fever, but blocking COX1 enzymes decreases the protective prostaglandins in the stomach and platelets. As a result, these drugs are effective anti-inflammatory agents but are more likely to cause gastric irritation, ulcers, and bleeding. Examples of these are aspirin, ibuprofen, diclofenac, naproxen, etc. Second are selective COX-2 inhibitors. These are NSAIDs that specifically block the COX-2 enzyme, which is mainly produced at the sites of inflammation. By inhibiting COX-2, they reduce pain, inflammation, and fever, while largely sparing COX-1, which protects the stomach lining. As a result, they cause fewer gastric side effects than traditional NSAIDs. However, they may increase the risk of cardiovascular events, so they should be used cautiously in patients with heart disease. Examples are celecoxib, etrolocoxib, etc. Here, aspirin is unique because it permanently blocks the COX enzyme. Since platelets cannot make new COX enzymes, its blood thinning effect lasts for the entire lifespan. In contrast, other NSAIDs block COX only temporarily, so their effects wear off once the drug leaves the body. So, although aspirin has anti-inflammatory action, it is not commonly used for treating inflammations today because the high doses needed increase the risk of side effects. Other NSAIDs such as ibuprofen, diclofenac are generally preferred. Now, some of the adverse effects of NSAIDs are gastric irritation and ulcers, kidney damage, increased bleeding tendency, and hypersensitivity reactions. So, what are the clinical uses of NSAIDs? NSAIDs are mostly preferred in pain, fever, arthritis, muscle or joint inflammations, and dysmenorrhea. This was all about NSAIDs. Now, let's understand something about corticosteroids. Corticosteroids are powerful anti-inflammatory agents that work through a different mechanism. They enter cells, bind to glucocorticoid receptors, and alter gene transcription, leading to inhibition of phospholipase A₂. Inhibition of phospholipase A₂ prevents release of arachidonic acid. This causes suppression of COX-2 expression. Hence, it results in reduced production of cytokines and inflammatory mediators. Thus, corticosteroids act at the genetic level to suppress the whole inflammatory process. Some examples of corticosteroids are prednisolone, dexamethasone, hydrocortisone, betamethasone, etc. These are extremely effective but must be used carefully due to serious side effects with long-term use. Now, adverse effects of corticosteroids are immunosuppression, hyperglycemia, osteoporosis, adrenal suppression, and mood or behavioral changes. Remember, no anti-inflammatory drug is completely safe. It's all about using the right drug in right dose. Corticosteroids are mostly used in autoimmune diseases, asthma, allergic reactions, and severe inflammation. So, to summarize what we have learned, inflammation is caused by mediators like prostaglandins. NSAIDs block COX enzymes, reducing prostaglandin synthesis, thus reducing pain, swelling, and fever. Corticosteroids act at the genetic level to suppress the whole inflammatory process. Both are important in managing inflammatory conditions but must be used judiciously. So, that's a wrap up on pharmacology of anti-inflammatory drugs. Thank you.